Melanie Bailey is Program Manager of the Provincial Immigration Partnership for Prince Edward Island at Immigrant and Refugee Services Association, IRSA. So I hand it over to her.
Thank you, Rodell. Thank you, Jessica. What an honor to be here as your keynote. And the irony is that all of this work was made possible because of you. The work you did, the report that was provided us the insight and knowledge we needed to move forward. Beginning after lockdown with COVID, we ran a number of surveys, and very quickly the crisis statements and the mental health needs emerged. And really, we didn't know where to start. I sent a message out through Basecamp. It's a tool the local immigration partnerships use to communicate. And the first response was Rodell, quick response, and his guidance, his insight, the documentation produced in the Peel region, even during Syria, and then the recent documentation and research that was done is what impacted everything we've done. And so I'm just going to walk you through that today. Really, it's a journey into what's possible when we have each other. And sharing my screen now, I'm opening up the first slide and really to focus on the journey to possible. And you know, like any of us that are dealing with difficult challenges, it certainly isn't easy, and it isn't easy to move action forward. And it does require insight, knowledge, data, surveys, ideas, recommendations, and people that have done it before that we can model. And this is where you came in. I can't thank each of you enough for your work and the impact it's had on Prince Edward Island. So today I'm going to walk through the background, kind of who we are and the surveys we did, which then led into the mental health risk factors and the research we did to understand what was happening. And all of this you'll understand yourselves. It's just to kind of set the foundation for where action launched from. I'll be showing a number of slides with data. I'm just going to kind of highlight the caption. I'm not going to speak to it very much, so the slides might go quickly. I will share the slides afterwards, and you certainly can go back to it. But for most of you, I think that it will be knowledge you already have. From that, knowing there was a need, we expanded mental health support. And then that question of how do you expand mental health support? What does culturally informed, trauma-informed healthcare support, mental health support look like? So then going to the experts and providers and hearing what they had to say. And then I'll speak to our journey and moving forward and where we are today. So to begin, really the impact of the pandemic can be experienced in a variety of ways. And really this is a normal response to situations where day-to-day routines are disrupted and circumstances are uncertain. So the background and the survey findings. So we are a small center, and so I try to kind of conceptualize where we fit, because I believe you're seeing 20,000 immigrants and we see 2,000 immigrants. So for us to do a survey and receive an average of 250 responses when we're seeing an average of 2,000 immigrants is a significant percentage. Whereas those in a large center seeing 20,000 immigrants would have to pull in thousands of responses to get that same percentage. So we did draw in a wide distribution. Most of our largest cultural groups were the ones that responded, and we did receive significant insight. This is our office here in Prince Edward Island. My project is province-wide in scope. We do have satellite offices. We do serve the province. Still, the majority are in our urban centers. This is the growth in immigrants that we've seen back from 2005 to 2022. We've been averaging 2,000 immigrants a year in the most recent years, of course, with the dip during COVID. During the surveys, we really wanted to understand the experiences of immigrants. And we know Canadians were struggling in many of the same ways, but on top of the struggles are the added challenges of learning English, children struggling within the culture and language. That missing family and friends back home was the immediate response people had. I'll just move the slide over now to the surveys that came later in 2020 and then in 2021, where suddenly missing family and friends took backstage because all of a sudden there were health concerns and access to health, and my concern for my job surged from 29% up to 42%, and concerns for paying my mortgage or rent as our housing costs have surged with this reduced housing supply. My business, I at first wasn't too worried about it, with 14% of people reporting, but over a year that surged up to 32%. And really all of this to say that these are all mental health risk factors. This all put our immigrant community in a position where they were potentially going to experience mental health challenges. And as we looked through the survey results and we looked at the data, we realized how significant the mental health challenges were. There were a number of crisis statements, and I have to say I'm so thankful to the province of PEI. I saw the enormity of the challenges, and when we shared the summaries and when we shared comments, they immediately said we needed to respond to mental health. And so that gave me the backing to move forward. But where we were going to move forward was still a question. I hadn't yet found Rodell, and I hadn't yet found other experts. And again, a number of comments that surfaced related to concerns and mental health challenges. Looking at anxiety and deep grief and just the overwhelming challenge of adjusting, and then wondering, well, if we're seeing these survey results, are others? And certainly they were. Cape Breton had done their survey a month before us. They had also identified mental health. Toronto was very influential in supporting us and confirming what we were seeing. They, of course, drew in a larger sample base, and they pulled in very specific mental health challenges, and they divided it by topic. This data was very supportive for us because it confirmed the comments we were seeing, and it confirmed the trends we were seeing as well. And we knew that we weren't in this alone, that this was happening across Canada, this was happening across the world, and we all just needed to figure it out together. So then we did some research into what that mental health looked like, what the mental health risk factors were, and research. And of course, there was a lot of discussions happening at that time. This was earlier in 2020 and moving into 2021. The research showed that everyone's mental health was struggling. 8% of Canadians reported FARE or mental health before the pandemic. That surged to 24% during the pandemic. So Canadians were struggling. And then on top of that, you saw an additional percentage, the immigrants were struggling even more. So we looked a number of statistics, a number of data was coming in at that time. We kind of took the data from all the sources to piece together a picture to help our providers understand what was happening. That yes, mental health was impacting everyone, but there were additional risk factors. And there were additional responses needed for our immigrant community. So we saw increased anxiety in the newer immigrant population. We saw moderate to severe anxiety was significantly higher in visible minorities. We saw in our survey that our immigrant community was reporting many business challenges and many job challenges. That was almost 33%, signifying significant mental health risk factors. And certainly when we pulled the data and we extracted those that were struggling with their business, maintaining healthy relationships surged to the top of their concerns. So you saw right there, the stress, the anxiety, and the impact on the family that was having when their business was struggling. We saw a very concerning rise in racism affecting our visible minorities. We became collectively aware of the racism that's been happening in our world. We also saw a surge in the Asian community racism early in COVID, trends that were exacerbated, some that were new, some that were existing, but all contributing to mental health. Of course, many of our immigrant communities were on the front lines in healthcare. They were experiencing extended overtime. They were working on the front lines, risking their health. Our nursing home workers, our healthcare workers were by and large our immigrant communities. Those numbers increased and they were experiencing significant mental health challenges. And as well, the ongoing challenge of the immigration journey. Our modern day pioneers, the courage and resiliency they show to move here, but the reality of the challenges of adjustment and culture shock, also a risk factor for mental health. Altogether, the bigger picture is that Mental health needs have increased, and that in the immigrant community, they have increased further. So this led to a call to action. We have the research, we have our surveys, we have the data all saying there's an increase in mental health needs. So what are we going to do about it? To begin, we had to simplify it. We weren't able to get people's attention. We weren't able to move that action in ways we had hoped. We had a potential funding opportunity opened up. We had the data. We knew we needed to move, but it's like any large challenge. There's so many people that have to be on board in order for that wheel to move. And I think probably the most discouraging thing for me was that fall of 2020 when everything had lined up, but still the work wouldn't move. And so we went back to the messaging. We just focused on a simple messaging. Newcomers are facing a decline in their well-being because of the pandemic, in a new environment, far from home. There is limited knowledge of symptoms, who to ask for help, and no known first language support in Prince Edward Island. And what we needed to do, we really needed to access and increase access to culturally informed mental health support. We did have some counseling services. It was very minor, and it wasn't a response to this work. It was someone in place to support during times of difficulty. However, a holistic response and reaching immigrant communities hadn't really been considered at this point because we weren't aware that need was there. So we found we needed to develop and distribute a self-assessment tool in mental health education into multiple languages, a mental health campaign to encourage those that were struggling to normalize accessing support. And I'll explain more about why that was needed from expert advice. And also discovered our helpline was only available in 2 languages, and there were times it wasn't available. This was something we were able to put forward through the province through budget submissions, and it was something they picked up. And a year later, we have a brand new helpline under development, a lot of innovation there. So the work we do, the research we do, it undercovers, it shows opportunities or areas that aren't working, and it provides opportunities for action. Also, really focusing on normalizing this experience. When you look at the big picture, when you look at the surveys and the journey of an immigrant, some of the larger challenges, accessing healthcare, the struggle with maintaining that full-time employment or insecurity in their job, the business viability, concerns for their business, the racism, trying to learn English. Now more people are work permit coming in as work permit, not eligible. So that has become more of an issue. And altogether that combines into, and on top of inflation, paying mortgage and rent as housing prices have surged. And then you dig through the layers of that. And what does that look like? It looks like family conflict and depression, concern for children, isolation and grief, and disconnection from cultural communities. And altogether, 68% of our immigrants reported stress. So that's a term that we came to learn, that there are terms that are acceptable. Stress is acceptable. Talking about depression and anxiety, some aren't ready for that. So it's finding terms that people are comfortable with and layering on that to give them the language and understanding of mental health challenges, and normalizing it and making it okay and working through stigmas. And so we knew all of this. We had the data, and really the concerns began to arise. Mental health belongs in the community. We're a settlement association. What about liability? What about professional standards? What about the fact, which also showed up in the Peel region's research, that mental health is often led by a settlement team that isn't a mental health provider? What about looking at job descriptions? And as you know, there's a shortage of registered social workers. Can we bring in somebody with a counseling background, psychology background, life skills background? And those questions were so big and so important that we got stuck. And this was where, from early fall, the work of Peel region began to impact and influence us, and has had a lasting impact. You provided us a roadmap for mental health services in settlement associations, and you normalized it for us. So there's two documents. One was a session and work that you did around the Syrian intake time, which is the first document there. And the second was your first version of the report, the final version being the one shared today. What you helped us understand was what professional standards and liability look like. You talked to us about what we can and can't do as a mental health service provider from within settlement. You talked to us about how we work within the settlement team, within the settlement association. And there were a lot of notes and discussions and data to follow related to how other settlement associations are responding, how they're meeting mental health needs, what they're looking at for professional standards and liability. And so for anyone starting fresh, like beginning this work, these are the concerns, these are the barriers. And so you helped us get through these barriers. The second piece gave us the roadmap. You gave us background and supporting document, an incredible amount of very useful research into how mental health support is embedded in settlement associations, including very open, frank discussions on trends and challenges and opportunities. You mapped mental health, the qualifications, job descriptions, boundaries. Every question, every concern was answered. As well, your survey results and mapping settlement and the mental health process. I can't thank you enough. Without this, we wouldn't have been able to move forward. The questions were too significant to allow us to move beyond. And this is where we could move beyond. So that also gave us the green light as well. We'd had funding in the wings waiting. We just needed the buy-in from those that would deliver the services. Your information provided us the roadmap for moving forward. From that and all the research that I did, I tried to make it very simple on those that were doing the work. And basically, I'm not a direct service provider. I'm a LIP. I'm an indirect service provider. Mental health is a priority on my list as well as Jessica. And so I wanted to make this as easy as possible for those that were providing services. And really it focused on 4 key priorities. There is the one-on-one counseling support. There is the self-assessment tool and the discussion around interpreters. That's a very difficult discussion because of privacy. But again, transcultural psychiatry and the research says that for serious trauma and significant challenges, it is important to have first language support in mental health delivery. For those of us challenged to provide that, there is discussions on interpreters, but there is confidentiality and privacy challenges there as well. So we're still in discovery on that topic on what's the best approach. On top of that, well-being promotion is critical, and group education, large group, small group, practical topics, parenting, relationships, culture shock, managing stress, coping strategies, practical topics like managing winter, new school opportunities, anything, and inserting mental health support within those acceptable topics. And that's kind of where we found was most helpful. And that again is that large group and small group so people can support each other. And also that focus on the helpline to continue to advocate for an improved helpline. We looked to the Peel region again. You did a wonderful document at the start of COVID. You said mental health needs are here. You quickly put together a document to support anyone delivering mental health services or who had a client experiencing a mental health challenge. So I said, we need to put together a document like that. We need to look at our helpline. We need to figure out how to get something with more languages, whether we make an agreement with Ontario where there is some good helplines in different languages, whether we do our own, but really just to advocate for that. And so we had all of this data. We had your roadmap. I had the research. I simplified it, a one-pager. We had the job description. We're ready to go. But still people had questions, and they were good questions because we really hadn't yet quite understood what culturally informed, trauma-informed mental health support looked like. This is a bit of an untapped field. You are the early adopters in Peel, Halton. You have stepped forward in developing that. And also we found an organization called FOOK. And FOOK Mental Health Association has been providing support to immigrants, mental health support to immigrants for decades. So we looked to you, to your research, we looked to Peel Halton, we looked to immigrants providing mental health support, and we looked to immigrants themselves to tell us what culturally informed mental health support would look like. Altogether, this is having an impact in Prince Edward Island. We are bringing culturally sensitive mental health support out into the communities, out into organizations. We're incubating it, we're developing it, we're learning it, we're sharing it. And it is all based on yourself and others that we have leaned on to understand what that might look like. And again, this is a new field. It's a untapped field, and each of you are the early adopters in innovating around this. There is huge potential to share this across Canada, to develop specific fields and sectors. It is a limited field and a growing field. Recently, Minister Fraser had said 1 in 4 Canadians are immigrants. So this is a huge opportunity to really change the mental health landscape. So the slide I have here relates to the focus group I did with immigrants. And this was one of the most difficult focus groups I ever did. It involved listening to some very difficult stories. Our approach to this focus group was to keep it small, to focus on immigrants and the cultural communities that we're by and large are seeing. We have 4 large immigrant communities: China, Vietnam, and Hong Kong. We have the Philippines, and we have India. And I hope I'm not missing any others. Other than that, we have medium-sized cultural communities. And so we saw a large surge in Syria. We're seeing a surge in Ukraine. We're seeing a surge in some of our Black communities. So we have our largest, and we have others coming in behind. So we reached out to those communities. We looked for registered nurses, medical doctors, physicians, crisis counselors, and other health professionals. Not all were licensed in Canada. Some were, some weren't, but we pulled together cultural community leaders that were health professionals. I have a link to all their advice. It isn't formatted in a wonderful format. It's just really the data about what the different cultural communities said, and what to be concerned about, what to think about when developing mental health support for the community. What stood out to me from every single cultural community, they all said the same thing. They said, touch the heart, speak to our heart. Each participating culture is looking for a warm and empathetic counseling approach, like a pre-counselor, helping get people comfortable with initial conversations on mental health, educating on mental health, and reaching out into communities to share insight, to tell them where to look for help, and to encourage them to come in and ask for help. We realized that there was no familiarity or words for mental health. People don't recognize symptoms. So really needing to focus on the symptoms, do that self-assessment tool. The participants described mental health over and over, each one, as feelings that well up in the heart that we don't understand or know what to do with. And they said, and then they feel like they're not normal. So there's huge stigmas in many of our cultural communities, and really giving words to it and destigmatizing it is important. People don't know who to talk to when they're scared, anxious, stressed, or have trouble managing. They're not from Canada. They don't have networks in place. They don't know where to turn. And the children are struggling, and the parents are grieving. They're seeing their children struggle. It wasn't the children's choice to immigrate, but now it's our kids that have to face the consequences and difficulties of immigration. And all cultures spoke on needing practical education and information session. They may not come just to learn about mental health, and maybe they're not comfortable talking about that yet, but they want and they need positive parenting classes, parenting coaching, parent coaching, family relationships, talking about the challenges of immigration, getting through winter, like I said, and then build in the mental health from there. FOOK, I'm going to speak to shortly. They also focused on supportive, uplifting language, such as promoting wellness or mental well-being. They said, don't use the words mental illness or issues. And they also said, focus on practical steps people can take to increase both their physical and mental wellness. So then we moved to the FOOK Mental Health Association by January of 2021. We were now developing mental health programming. We had the roadmap from you. We had the urgency and the advice from our immigrant community. We were beginning to get the commitment. We were still struggling to get the commitment in some ways. So we brought everyone together, those fully on board and those that were not quite yet sure where they stood on this response. And FOOK came to us and we formed a group like we have here today, and we brought everyone together and we had FOOK talk to us, and we did Q&As, and we just talked through and sorted through what we needed to do. So this slide here is just on the FOOK Mental Health Association and the programming they lead. They're, I think, maybe the gold standard, and I think there's others like them across Canada, but they are the one we found, and their client base is similar to our client base. The key findings, they had many findings, actually. There was a long presentation, great data. I'm extracting just 4 slides of what kind of was most helpful for us. So the key findings are the mental health stigma, work-related stress, reasons for not seeking help, and the kinds of help respondents need most. So again, back to the stigma, huge stigma. More than 50% of their respondents had inaccurate or negative views of mental illness. So any work that's done really does have to focus on tackling the stigma. Work-related stress, you know, while there is stigma and while there's many mental health topics that are taboo, people are very comfortable talking about stress. And there's a lot of it. There's work-related stress, there's family stress. And so that is actually the starting point, and was the starting point for us in initiating mental health services, in inviting groups in to talk about stress. So this was probably one of the more helpful pieces of advice, that there is an incredible amount of stress in the immigrant community and in the immigrant journey. And starting at that point has led to an incredible amount of mental health programming and more buy-in from our cultural communities. Not seeking help, preferring self-management, the language barrier, culture not ready yet, time, accessibility, finance. Preferring self-management, language barrier, and culture all kind of grouped together towards that piece around stigma and not wanting to reach out for help, and feeling ashamed and feeling like there's something wrong with me and not wanting to reach out and not even knowing where to reach out to. And really the most helpful in informing culturally informed mental health care is that it isn't just the one-on-one model. What immigrants were looking for is a very evenly split distribution of services. So there is the counseling one-on-one model. There is also the education workshops in the large group and small group, which allows you to reach more people to get the education that's needed out there and to create support groups. And 38% information about mental health problems, treatments, and available services. So really it's your counseling, it's those education workshops, and it's sharing information. And that is the guidebook for that responding to our cultural communities. So this is a shift here. I'm going to move into us moving forward. So that's all the background data. So it's pretty exciting. Actually, we've moved forward, and then I'm going to move and transition from the excitement to, oh my goodness, the trends are still increasing, and there's new trends. We all thought COVID would end or peter out, or we would live with it, but that we would emerge from lockdown and things would be better. But unfortunately, in the mental health work, it did not do as anticipated, and things have worsened in a number of ways. So we're going to talk the good news, and then we're going to talk about some of those current trends and all the work we have in really moving forward and strengthening each other and taking care of each other, because there continues to be so much to respond to. So the first piece is our expanded mental health support. So thanks to you and all those that we worked with, we have expanded mental health support. The province is doing innovation around mental health support. Our research helped inform some of their work. Our research informed our work, and our research is now informing the work of many other partners outside of settlement who are mental health service providers. So we have now increased, we're up to, and again, we're a small center. We just see 2,000 immigrants a year. but we have 3 full-time counselors on staff. But we also have students working with us. We're also working with the university, and we're also working with other providers to teach and train. So we really increased access to support. So through our organization, we have 3 full-time family counselors. We're educating and collaborating with other providers, training and learning and teaching. We've got education on mental health supports and referrals for services ongoing and going out in the community, and that continues to be a priority. We developed a self-assessment tool. It was a little more difficult than we thought. We're looking at simplifying it further and then translating into multiple languages. Again, we're struggling with the fact all all mental health service providers predominantly speak English or French. We do have some immigrants in that space speaking different languages, but it doesn't represent all of our cultures. And again, McGill's research says that for trauma and for significant mental health needs, that first language support is a need. So that continues to be a challenge for us. Well-being, promotion, and education. And, it's not just the 3 teams. There's Canada School, there's other teams that do training. There's, of course, the 3 counselors. So that well-being, promotion, and education is in all of those programs now. And it's in with all of our service providers, and it's with all of the community organizations. Lot of well-being, training, education, normalizing, small group learning sessions, insight workshops, interactive sessions. And so that has been significant. And the best news, one of the latest best news, good news stories is the change. So we have a new helpline underway. We have this mobile health unit that responds to emergencies in diffusing situations. And that is now linked to a brand new helpline as of a few weeks ago that launched. So we have our own PEI helpline linked to the mobile mental health. Over the last 2 years, our mental health system has innovated in ways that are very encouraging. And I feel like if we can do this, and if the mental health system can do this, then certainly the healthcare system and the housing situation can get fixed. I feel like with enough people, enough commitment, enough focus, and enough of us working together and sharing resources, we can move mountains. And this is an example of that. The good news is all of the programming I mentioned, these are just some of the flyers that have been underway. Ongoing, constant programming. Staff are working so hard. There's a new alliance that was formed to bring the entire mental health sector together to network, and they have funding opportunities. So more people are able to access funding, and more people are able to become part of that network where there's more sharing of knowledge and insight. There was a mental health and addiction summit, next step, again, bringing the entire mental health sector together. And there's the mobile mental health response related to PEI's response to a new helpline and a mobile response for diffusing situations, but a helpline for emergencies. The summit is a process that we're looking at modeling actually in our own work. They come together 4 times a year. We may do it only 2 times. It's a way to keep all the partners coming together and networking and sharing knowledge. And I just wanted to point to this wonderful story. This is from Brampton, Ontario, and I can't understate the impact of cultural communities in how they can support each other, how they can come together through events and activities and support groups. And this is a story of an immigrant who formed a support group for his community. So there's a job for all of us. There's a job for service providers. There's a job for community agencies. There's a job for the immigrants themselves. So now we move into, and this will come to that last quarter of the presentation. And I just want to draw attention to the new trends that are underway. I don't think it's a surprise to anyone, but I think it's a surprise in how significant and concerning the trends are. And also in the fact that these issues didn't go away, that they have been sustained and have increased despite opening up, despite lockdowns ending. While some challenges exacerbated by COVID are more visible, like the labor crisis and housing shortages, other challenges exacerbated by COVID are a silent crisis, known only to those working in the field or impacted, like this increase in mental health. But quieter still is what is happening to our youth. and a concerning slide to come. So I spoke with the vice president of data with the Kids Help Phone, and he kind of pointed me to where to pull data. So the Kids Help Phone has access to data. And when you look at 4 indicators around suicide and suicidal thoughts, you can see the calls for this have doubled. The peer and partner relationships have also increased. Family changes and relationships with families, issues there has doubled. And the mental and emotional health challenges went from 44% up to 76%. So the trends are concerning. The needs are not going down. Our work, I believe, has only started. The VP of the Kids Help Phone said, "We've seen a rapid and sustained increase in needs in the youth population since 2020. International research findings have extracted data to show there's certain age groups that were more impacted. Both youth and seniors were impacted in ways that we never imagined. There's significant trends around males being more impacted, certain ages for all teens being impacted, higher rates of anxiety, more use of substances. And in the US, they're also seeing the same thing. Their helplines are also seeing an increase in demand and needs. The US and Canada's data is very similar in saying that the youth mental health has increased significantly and has not come down. Just to bring it down a second, those are kind of high level and really to normalize it. Like these challenges were always there. COVID has exacerbated it, and unfortunately, it has been a trend where it has continued to increase. But really, when you look at the big picture, we're here supporting immigrants. Our immigrants do face difficulties being in a new country. Children face difficulties, and parents struggle to know how to help. There were, in surveys from us and others, newcomers reporting concerns for their children's well-being, many reasons, English and cultural differences, and the challenges of immigration. Many of our children, our immigrant children, they experienced COVID-19 with only one parent in PEI. Often another parent was overseas helping families or taking care of a business. So we saw a lot of family separation. And newcomers face mental health challenges during the pandemic. In a new environment, far from home, there's limited knowledge of basic symptoms, language barriers, expressions of deep worry, shame, and concern for what others will think. Everything we talked about. So our work is absolutely essential. It is critical. There was always a need for it. There is an even greater need for it now. I'm going to touch on 2 topics briefly, and discrimination. There's some national groups talking through discrimination. Discrimination happens in communities and workplaces and schools. It is very harmful in schools, and children spend most of their time in schools. So really to advocate for support in schools in order to respond to the racism that's happening there. And we're not alone in this. We've had some national discussions, and the trend that we've all seen is we're all seeing heightened racism in schools. So in PEI, 35% of participants advised their children had experienced racism in K to 12. And that was a broad distribution. Vietnam, Hong Kong, China, others specified below, India, Nigeria, Philippines, France, Syria, Taiwan. Racism is experienced by all of our immigrant communities. When I took all of the data and I extracted just the people who had said their children had experienced racism, and then I looked at what their 3 most difficult challenges were, it was no longer employment or housing. It was discrimination, mental health, and their children not doing well, which speaks to the harm of racism and the mental health impacts it causes. There is a story here. There are many other stories. These are deeply troubling. For those of you that have been impacted or that have had children impacted, this is hard to read. My child also experienced, and so I feel as well the experiences that you felt. I understand them also. what I have found helpful is supporting those that are tackling these issues. So it's to look out into the community to see who is responding, who is doing the work, how do I help them? This is hard, deep emotional labor work they're doing. How do we help them? How do we strengthen them? For me, it involved telling my story to 90 people, which was difficult and not what I wanted to do, but we have to tell the stories. We have to support the people who are doing this work so they're not alone in telling the stories. We have many initiatives and encouraging momentum underway in Prince Edward Island right now, and we're still exploring how to help, and we're still exploring the mental health impacts of racism. I've particularly wanted to point out a really good program in Brandon University. It's anti-racism educational material, facilitation guides, and incredible videos that shock and teach. Very short videos, very well done. The material is being shared through Brandon University, Dr. Michelle Lamb and her team. All material is free for use. Any of us in Canada can use it, and it's found at that link. And in the work of tackling racism, and in the work of strengthening people's mental health, this is a wonderful resource. And just to touch on COVID learning gaps, Ontario has released an article and responses. You have stepped forward to respond to the COVID learning gaps. This, again, is going to impact our children's mental health. They've fallen behind in reading, writing, and math. They're struggling to catch up. They're feeling discouraged and hopeless and like there's something wrong with them. They're disengaging with school. The path forward is going to be very difficult. There are COVID learning gaps. Responses to support children in reading, writing, and math are needed. This goes hand in hand as well with their mental health. For us, we then turned it all into like a strategic plan, and these are just the strategic priorities, and we'll move it into next steps. So based on all your work and all your help, we've done the research. You gave us the roadmap. We sought advice and got input on what that culturally informed, trauma-informed mental health looked like. We stepped forward and developed programming. So now we need to continue to expand that, sustain it, share learnings with all the other mental health service providers, to continue to improve around self-assessment tools and large group education, to expand that work, to look at youth well-being, to respond to those well-being trends and racism and the COVID learning gaps that are impacting our youth. And this slide here was some data that I didn't get in time, but I just want to encourage you. We are the mental health settlement. We are the settlement service provider. We are supporting mental health within settlement. We are incubating what culturally informed mental health looks like, but our providers are universities, mental health service providers, there are schools, they're the Department of Education, they're the community groups, the social groups, they're the hospitals, they're the acute mental health care. Literally the team of providers at the Settlement Association have expanded all those relationships. They're doing research with the psychology department. We have a doctor of psychology at UPEI. One of the students is interning at our office. So we're learning from her, she's learning from us. So that's basically what we've done is we've gone out, we go to their sessions, they come to our sessions, we partner on projects, we invite students to work with us, we do training with other providers. So basically it's like taking the work on the road so that we can teach others and work together and collaborate. And on this note, I'll just mention this week, we found out that family violence from last year from 2021 to 2022, incidents of severe family violence with police involved has doubled. Mental health needs have quadrupled. Schools reporting waves of mental health needs that they're so overwhelmed, they don't know how to respond, they're putting their hands up. So we are in a time of difficulty. Our work is more important than it ever has been. And I just want to leave this on just a few quotes. And I think as you go into your session today and as you're speaking, I think these needs demand honest and authentic conversation. I think each of us is fragile. Nerves are frayed, so to be kind and gentle with each other. And also that a careful conversation is a failed conversation because it merely postpones the conversation that wants and needs to take place. And I think today, this is your time for those conversations. And really, if you're scared to speak up, we can ask ourselves, as I did, in moving into a room to tell my story on racism, if nothing changes, what are the implications? So now more than ever, to be able to speak up is important. And the hope each of us has for a better tomorrow, and that each of us can be part of that for our immigrant community. And just a huge thanks again to each of you. Your work made such an impact in Prince Edward Island, and I can't thank you enough.